ladies and gentlemen, back to you again. I am Yamaayah Subadev, a sophomore of University Malaya, a home tutor and a model and actress by passion. And I am here today for the episode 7 Women of Essence series. Now, just before we begin, guys, I have a humble request to all of you. Please do share this video around to your family and friends with the hope that this today's topic on Own Your Health might be beneficial to you. Now, just before we begin, allow me to introduce a little bit on Bikini Resources, which is the most comprehensive consulting company in working with individual businesses, universities, schools, government, and organization, conducting seminar, workshop, special program, individual services, and private consulting, all relating to the physical, social, and psychological of personal appearances. Now, Women of Essence series especially aims to bring in women from all walks of life to come and share with us to come and share to underprivileged women on how they can get inspired and their interesting personalities to share and to teach these underprivileged women how to persevere for success. Now, now, on today's topic, on your health. As we build in a better future, we persevere for success. We also always have to give our health a priority. And for today's topic, we feel honored to have with us Dr. Gokilavani Sekar Chandran for today's talk. Now, permit me to bring Dr. Vani to our broadcast studio.
Hi,
Hi, doctor. How are you today?
I'm good, Yamaya. How are you?
I'm doing well.
Yeah.
Now, allow me to introduce a little bit about you to our dear viewers, doctor. Now, Dr. Vani has graduated from the University of Auckland, New Zealand, and is very passionate about educating to the community on the importance of health literacy. She have also started social media and put on great efforts to educate the community on the importance of health empowerment. Now, what a wonderful effort is that, Doctor, and it's great to have you today on board. I would love to actually know further about your experience, how is your journey throughout being in the medical profession, and what exactly inspired you to kickstart and advocate for health and wellness.
Okay, thanks, Yamaya.
Yeah.
Firstly, hi everyone. Thanks for having me on your live talk this evening. It's my absolute pleasure to join your channel this evening and to try and raise awareness around health. And I think the topic today is Own Your Health. So I'll be talking shortly about what we'll be discussing. But like Yamaya said, I graduated from the University of Auckland. And then I went on to do my just over 2 years postgraduate diploma in pediatrics. And then I was lucky enough while I was in New Zealand itself to do a medical education fellowship to work closely with the University of Auckland and one of the largest hospitals in New Zealand, where I learned where that's where actually I gained my passion about health education and how to relay health awareness and the importance of health awareness and health education. Then I went into general practice. Then when I came back home, I spent some time with internal medicine in PPUM, and then I'm now back in general practice, doing the things I love. So as you can tell, my passion is primary care, and my biggest passion is health education. So I try and raise awareness amongst my patients. Mainly, I try and get them to become more empowered. It's called patient empowerment or becoming empowered patient, and I'll be talking about that shortly as well and why that's important. So that is my long story short journey in
That's
medicine.
wonderful. That's wonderful.
Mm.
It's very rare for us, not to say rare, but rather we don't see many health profession actually speaking on this on social media when we really need it nowadays. And I was really overwhelmed. Is there any particular incident or anything that actually brought you to empower to give this education? And what do you think about how professionals should use social media to educate people about health
Mm.
empowerment?
Absolutely. So two things. Firstly, I realized that health literacy itself amongst our community was quite low. There was still a lot of myths around, medical signs and symptoms. There was still a lot of reluctance and lack of confidence in medical doctors, as per se. And there are alternative therapies, but some of the alternative therapies were followed. Some patients tend to follow it dangerously or in unsafe way. The other thing was, just recently, actually, before I started my page, I started to see a worrying trend on social media. Obviously, social media is unfiltered. We get a lot of good things, we're exposed to a lot of bad things at the same time. But I started seeing a lot of health wise negative influences that were coming up. There was a promotion of things like alcohol very openly on social media, and some risky behaviors. So that started worrying me, mainly after having a baby, because I was like, what is my daughter going to be exposed to in 10, 15 years time when she sees social media, and what kind of message that we actually want to send out there. And then as I was talking to my patients, and I thought, what, I can educate my patients within my consult setting, but I felt like that message could go across to many more if we shared that on social media. So recently I started my page and started sharing evidence-based medicine. That means whatever that's shared is based on evidence. It's backed up by science, and trying to explain the rationale behind common health issues, and how people can go about it, so that the health literacy. So when we say health literacy, it's people's understanding about their condition, the medical condition, medications and stuff, so that even if in some small ways your health literacy can improve, actually you will see overall improvement in your quality of life. So that is the reason I ventured into this whole health awareness on social media.
That's wonderful, doctor. And I did personally as well went through your page, and I find it very resourceful.
Thanks.
Maybe you can give us a little background of the diseases in Malaysia, and
Hmm.
what is the most trending, or most, how do I say, in your
Hmm.
experience as a doctor and a
Hmm.
medical practitioner,
Hmm.
what is the much most highest cases in Malaysia at which we have to take precaution for?
Okay, so I think before I go on to that, I'll just sort of give a brief summary to our viewers as to what they can expect over the
Yeah,
next 40 minutes or so.
yeah,
So I'll be talking about why regular health checkups are important and why you should consider getting them, what type of health screenings there may be available to you outside, and also how to become an empowered patient, and take charge of your health. And that's why I titled the talk Own Your Health, because you have to play a more active role in health. Yeah.
yeah,
So an example is that, for instance, I just an example is, you've got money. Okay. You hold on to your money. You can be passive with your money. That means you put your money, store it in the bank, then never look at it, and then you look at it in 5 to 10 years time and go, oh, this is the amount of interest I've accrued, or this is what I've lost because I've spent on my credit card. Or you can actively manage your money. That means, you look at different portfolios to invest in, you look at, growing your money, you track your money, and you will notice that, obviously, passive or active, you'll see growth in terms of when you're actively involved. And I
yeah,
want people to start looking at their health the same way as well. Instead of passively managing your health, start engaging in your health actively. Have loud conversations about your health. Get comfortable with your health, get comfortable with your doctor or your care provider, and we'll be talking about this shortly. So when you asked me about disease burden, right?
yeah.
I'll just give you one example of a disease burden, and I'm not sure, and I think this will kind of touch some of our viewers quite close to heart as well. The incident that happened yesterday, I'm not sure actor Vivek passed away, right?
Yes,
Yesterday.
yes.
Yeah.
It was such a saddening news for all of us.
Yeah, it felt like a personal loss.
Yeah.
And the worst part, what I felt sad about, was he died due to a heart attack at the age of 59. It is a completely I won't say completely preventable. At least you could have reduced the risk of him getting it, or you could have prevented the event in some way. And it's such a sad loss. It's a sad loss that he passed away due to heart attack. And I want people to know, like, heart disease, right? In Malaysia, let's come back to Malaysia. So heart disease in Malaysia, compared to our neighboring countries, Thailand, Singapore, we still have a higher prevalence of heart conditions such as heart attack, and the mean age to get heart attack in Malaysia is lower. So in Malaysia, the mean age where people get heart attack is about 58 to 59 years old. Okay, whereas in places like Thailand and Singapore, it's 63 or 70 years old. So we are getting heart attack at a younger age. And when I worked in intermedicine PPM, we even saw people coming in with even more younger age. Once I was in ED and a guy in 26 years old came in with heart attack, and that's completely unacceptable, I think. But obviously, yeah. And this is because, let's come to heart diseases, right? Heart attack. There are risk factors that, you have all these risk factors that make you prone to heart disease. For example, there are these modifiable risk factors, which means risk factors that you can change or alter actively. And then there are these non-modifiable risk factors. Your non-modifiable risk factors are things like your age. You can't alter your age. You're going to keep aging, right? And then, and then your genetics. As you know, we Indians, are prone to getting beautiful genetics, whether it comes to high cholesterol or heart diseases, and then your family history. We can't change our family history. If you do happen to have family members who pass away at a very young age due to heart attack, that means you have a higher risk of it. Yeah. So these are some non-modifiable risk factors. Whereas on the other hand, there are some things that you can actually work on to reduce your risk of these diseases. Okay, so let's stick to heart disease. Some of the example is diabetes. Yeah, you can do something about your diabetes. If you have diabetes, you can work on controlling your diabetes. Secondly, high blood pressure. Same thing. You can, go to your doctors, get checked for high blood pressure, and you can treat your high blood pressure. Third, obesity. Obesity is becoming more and more of an issue now. And even with the pandemic, it's getting more worse because of sedentary lifestyle. We are home more, we are eating more, we are working out less. But you can actively, again, manage it, weight loss, right? The other risk factor is high cholesterol. Our Malaysian diet, we love our roti canai and our nasi lemak and our curries with extra oil,
It's
so
unavoidable.
exactly. So then that's your high cholesterol is one of it. Yeah. So you have all these risk factors which are modifiable. Smoking is a huge risk factor. So if we looked at these individual numbers, right, up to about half of our population, let's say about up to 50% men, women have high cholesterol. Okay, about 1/3 of us adult population have high blood pressure.
Yeah.
Okay, and more than 60% of us, that means 2/3. Okay, if you have three people, two of them are obese. Okay, and this trend is only going to keep increasing if we don't do something about it. Right? This is just one example, heart disease. Okay, the most prevalent one, and sadly something that we can prevent. Like, again, I'm coming back to Vivek. Okay, I'm just using him as an example. I'm not using him as an absolute case, but using him as an example. So this is where regular health checks come into play. All right, I usually tell my patients, once you are over the age of 30 years old, whether you're a man or a woman, get yourself checked with your doctor annually, at least once a year, if your health check is normal. Okay, this is so that, firstly, if you have risk factors to a specific condition, for instance, let's say my family, I have diabetes, high blood pressure, my grandfather had heart attack, stroke, etc. So this puts me at higher risk of these conditions. So I should be getting myself, and my family members should be getting themselves checked every year once they've passed the age 30 years old. Okay, of course, if you are getting yourself checked every year prior to being 30, that's fine. Great job, continue doing that. But if you haven't thought about it, pick a date, pick a time, go see your doctor. Don't just tell yourself, I'm going to see the doctor at some time, because that sometime will become 2024 or 2026. Okay, so this year, if you haven't seen your doctor for a regular health checkup, pick a date, pick a time that you like. When you're free, go meet your doctor. So why do you need regular health checkup? One, is so that your doctors can identify your risk of developing certain illness, if whether it's heart condition, or let's say your family, you have a family history of cancer, they can look at this particular risk factor, okay? And if you do have the disease and they pick it up, it can be treated early. You don't have to wait till it comes to the severe end of the spectrum before you start treating yourself, okay? Again, it's a cost factor that's involved. I know a lot of people think, ignorance is bliss, not knowing is better. I'm happy with my life, I'm carrying on, I'm super happy. Why should I know if I have a certain condition? Why are you killing my joy? No, but you're going to kill your joy worse if you're going to find it out at the end of the spectrum. You're going to trouble yourself, you're going to trouble people around you. In fact, it's more cost effective if you find out much earlier and you do something about it much earlier before you get to the end of the spectrum. Yeah, diabetes, you can manage it, lifestyle, diet, exercise, pills. There are effective pills before it comes to losing your leg. Do you know what I mean? So don't get to a point where you're losing your leg. Get it checked early. Yeah, so doctors can treat you early. It's cost effective. Also, I feel when you do go for your regular health checks, you become more motivated to follow those healthy lifestyle. You can kind of create that partnership with your doctor, and someone's going to have your back, someone's there to advise you, someone is there watching your progress in health, tracking your progress, and you'll be motivated to maintain that healthy lifestyle, okay? And you can avoid unnecessary diseases. Like if you go and you get your vaccinations, for instance, I get my influenza vaccination every year. Doesn't mean I'm not going to get influenza. I may get influenza, but it just means I'm not going to end up in the hospital 5 days with influenza. Anyone who's had influenza before this knows that it's awful. And if you do get it and you're not vaccinated, you're going to end up in the hospital at least for 5 days. You do not want that. So if I'm vaccinated, then I'm likely to just get away with the mild symptoms. So this is importance of regular health checkup. Okay. So then people ask me, okay, where do I go for this regular health checks? Go to your local GPs. Okay, go to your nearest doctor. I think it's very important. Back in the day, there was this concept of family doctor. I'm not sure when you grew up, did you have a family doctor? Okay.
Yeah, they always had the same.
Correct. And did you see the family doctor from when you were a baby all the way up to when you graduated?
Yes.
Yeah. So, and you kind of had that personal relationship. He knew your parents, he knew your grandparents, your doctor's likely to know you, and you feel comfortable with them. That's the kind of relationship I want everyone to create with their doctor. Find yourself a family doctor, someone who you're comfortable with, someone who you can trust, someone you're happy to follow up long term with. Okay, so that you can have a holistic, that means the person can look at you in a whole perspective. That means they're not just looking at you when you have a cough and cold and looking at just your lungs or just your tummy. They can have a look at you as a person, and they can, you can create that partnership with them and decide what's best for you. So it's very important that people go and find themselves a good trusted family doctor who, most importantly, listens to them. Okay, I think we've long moved from back in the day we used to call this paternalistic style of medicine. Not sure, are you familiar with that term, paternalistic style? Okay.
Not quite. Maybe you can explain this to
Yeah.
the audience as well.
Paternalistic medicine is when the doctor tells you what to do. So it's kind of, if you can imagine someone standing up with you, you have got this, you do this, and and kind of thing. So people used to look up doctor. Yeah, doctor must be right. Yeah, the doctor said I'll do that. But we've moved far away from that now. It's more of a two-way conversation these days. It's called the doctor-patient relationship. You can ask your doctor questions, actively ask them questions, and get them to share the information with you. It's a partnership. Okay, it shouldn't be a one-way relationship. That's when you kind of tend to get put off and you won't get motivated. So you should be creating that partnership with your doctor, and don't be afraid to create that partnership. I think some of us are still quite reluctant in that sense, and that's why I feel it's very important for you to find someone you can trust and be confident with.
That's a very insightful sharing, doctor. And coming to
Mhm.
that, it hits my mind because me too personally, I always had this thought that how about the cost? Where is it? Where do we get a proper doctor these days? Who do we trust? Where can we get? I mean, the doctor who would really thoroughly have better two-way communication, someone who we
Yeah.
can speak to better. So, how do we know as a general public? Yeah.
Do your shopping, do your research. There are
Yes.
reviews now, so many reviews out there. There are many apps you can find your doctors. You can go around and do your shopping, meet a couple of them, see who you are happy with. So this was something that hit me close, like when I was pregnant, and I in the first 3 months of my pregnancy, I had difficulty finding, because I was suffering from very bad vomiting and nausea, and I was frequently admitted, and I frequently needed to see a doctor. And then I realized it took me many encounters before I found someone that I'm comfortable with and I'm happy sticking around. So sometimes you need to do that little bit of doctor shopping. Don't feel like you're limited just because there's just this 1% I have to put up. No, don't feel like that. Do your shopping, do your research, do your due diligence. I think you'll be doing the same thing if you were to buy a house. You'll be looking at which bank gives you the
Yes.
cheapest offer and things like that. Don't just look at the cost aspect. Okay, it's quality. It's always quality over quantity, right? So always do what's best for you, and do a bit of shopping. There are a lot of hospitals that do regular health checkup as well. Some patients prefer to follow up with a particular hospitals, for instance, and a lot of hospitals have packages. There are GP clinics that have packages. Government clinics do health screenings as well. So you can take your pick, do a due diligence, do your research, and then take your pick as to who you want to follow up with. Mm.
Okay, that's very helpful, doctor. But you did mention something regarding about the application and where we
Yeah.
can get. Can you
Mm.
share us a little bit on that?
There are many apps online now. Actually, it's almost unlimited ones. So I think you people can, have a look themselves. There are many telemedicine platforms now as well.
Yes.
Telemedicine is kind of becoming the future, especially in general practice. Of course, when it comes to regular health checkup, I would advise people do not do it over telemedicine. Go and see your doctor in person. Get yourself physically examined. Speak to your doctor. At the end of the day, that human interaction is,
It's
is
always
is
the
what
best.
it's always the best.
Yeah.
But if you want to follow up other things on telemedicine, like you have a cough or cold and you want to do that, that's fine. But sometimes when you already have that personal touch, then you would want to prefer to see your doctor. I don't know. Back in the day, I always had this feeling whenever I saw my family doctor, and then I just got better by just seeing him, right? But that is actually the reassurance part. It's not magic. It's just that the relationship we had with him, the fact that when you went to see him, he reassured you, actually this is a cold, you're going to be fine, you just rest, drink plenty of water. That's why you feel better, right? Not because he had like a magic pill and he gave me vitamin C
Yes.
and then I got better immediately within one pill. So that's what people should be doing. And my key message, I think, is, yeah, find yourself a doctor you're comfortable with and confident with. Yeah. And coming back to sort of your health checks, right? Like I said, so what can you expect when you go for a regular health checkup, right? What to expect? I think this is something that people don't realize as well, what they should be expecting. So first, when my patient comes to me for regular health check, I take their personal history. That means their personal health history. I do take their occupational history, their social history, their family history, and also any previous health history. Okay, so it's basically we get a lot of, to get a good picture of your whole self and what's going on. Then there'll be some basic examination that happens. So we'll be examining the heart, the lungs, the tummy, and it depends. If you're a woman, you may have a breast examination if you haven't already had one. I highly encourage girls. I'll come to that shortly when we talk about
Yes.
health screening. Yeah. So you have your examination, you have your blood pressure taken, your weight and your height taken, so we could calculate your BMI and follow that through. And during this check, perhaps a blood test would be sent, and the type of blood test sent will depend on your health risk profile, yeah, and what you come in with. Perhaps there will be some investigation carried out. Like I said, if you're a woman and you're coming in, you might get a pap smear while you're there. And then once the results of the investigations are available and we have a good picture of your overall health, then there'll be a separate consultation on how you can manage your health from here on. What are the most important thing I always feel are lifestyle interventions. Throwing a pill doesn't solve anything. You have to get your basics right first. So when I say lifestyle, it means things like quitting smoking. Okay, reducing smoking is not acceptable. You have to quit. Okay, quitting smoking. Smoking is the single most biggest risk factor that is modifiable, and it is a major risk factor for things like heart disease and lung cancer. And I feel like, and there's so many help out there. People don't realize that to quit smoking, there are huge help out there. There are medications you can try. There are very effective methods to help quit smoking. So quit smoking. So the lifestyle interventions are quit smoking. You'll be advised on your dietary management, your physical activity, and then you will be given a personalized healthcare plan, and also how often you should be getting your regular health checks. If there are issues, then you may be needing to see your doctor more frequently than every year. Once your health results come back. So these are the typical thing what happens during a regular health checkup. If you go to a hospital-based health checkup, you may get even more investigations done. So they may be able to do a stress test for you, an ultrasound for you, and all of that. So that depends on the package that you want and what you discuss with your doctor is appropriate for you. So that's what's involved in a regular health check.
Thank you, doctor. That's very actually insightful. In fact, even I'm considering now to go. Actually, it came out to my mind because all this while, being as a youth myself, I have the interpretation that my body is healthy. I don't think that I feel I need a checkup now. So as of now, it comes to the myth. Should we always stand into that perspective that our body is healthy? Who would you advise to go for a regular checkup first? Is it only for people above 30 years old, as you mentioned earlier?
So you just raised a good point. As a youth, you feel very healthy. I don't need to see a doctor. So speaking of youth, there are a few health conditions that seem to be more prevalent among youth, especially now during pandemic. I see a lot of mental health issues among youth. People who fall under the youth category, 15 to 29. There are a lot of depression. There's lots of anxiety issues, mainly because of the nature of stresses that's happening during this pandemic. And there are screening surveys, effective screening tools available for that. So only if you meet a doctor and you have a chat with them, they'll be able to pick up on the signs and symptoms of this and can treat you earlier rather than you getting to a point where that's extreme. So that's one, mental health screening. So I think I'll touch on screening now. So there's mental health screening. Another thing that I think youth really, they're shy to talk to their doctors, but it's very important. It's a very vital part. It's your sexual health screening. So youth who are sexually active, if they're concerned about their sexual health, especially around things like sexually transmitted infections, then they should be seeing their doctor. They should be getting screened for it, because again, there are effective treatment available for it, and it's easily preventable with preventative measures. I think anyone who would have watched my contraception talk last week would have known, just kept stressing the importance of using barrier methods to reduce sexually transmitted infections, mainly amongst the youth. Again, your mental health screening, your sexual health screening, And women above the age of 20 who are sexually active, coming to women's health, they should be getting their pap smears done. So this is to have a look at your cervical cells. Are they healthy? Are there any early signs of cervical cancer? Now there are some very effective swabs, so that the samplings that can be sent, and usually we say for cervical pap smears, you should do two. Like, let's say you get one done this year, and that's normal. Get another one done next year, and if they're both normal, then you only need them every 2 or 3 years. And that's quite easy to remember. I think if you're following up with a doctor regularly, even they will remind you. Like if you're following up with me, and I'll be like, hey, your last pap smear was in 2020. Before that was 2019. Both were normal. I think you're due for one next year or the year after. How do you feel about that? Okay. That's cervical smear, yeah. And then the other thing for women's health is breast cancer. So breast cancer is one of the most prevalent cancers among women. So how you can avoid that? Get yourself, firstly, check yourself out regularly when you're home. Do self breast examination. If you feel any weird lumps or bumps, go see your doctor immediately. If you're going for your regular checkups, then your doctor can do a breast examination. And if that's normal, then women above certain age, usually above 40, then they should be getting their annual mammogram done. Okay. And if they have high risk factor, for instance, I have a family member with breast cancer before this, so then I should be getting my mammogram done earlier. So you can discuss this. This is all very personalized. So you can discuss with your doctor how often you should be getting your mammogram and where you can get them, etc. So these are important when it comes to women's health. Yeah. Then the other screening that's available there, speaking of cancer, you can test for bowel cancer. So people above a certain age, above 50, above 60, you can go for your regular bowel cancer screening. It's just done by a simple stool test that's sent to the lab. Or if you have a first degree family member with bowel cancer, then you should be starting your screening earlier. And again, your doctor will be discussing that with you. Yeah. So these are some of the health screening that's available there. So we spoke about heart disease screening earlier itself. So heart disease screening, you'll be doing your blood pressure, your ECG. If you're in a hospital, they'll get you to run on a treadmill and do stress tests. Blood tests, like, we spoke about the risk factors. We can have a look at what your cholesterol is doing, what your diabetes is doing. Yeah. So these are all for heart disease screening, your cancer screening, women's health, men's health. So screening for prostate cancer can be a bit controversial topic. So because some believe, is it necessarily needed to screen, to have universal screening, or should it be targeted screening? So again, you should be speaking to your doctor about this so that you can tailor make it depending on your age and your risk factor. So that's cancer. And then you have your mental health screening, sexual health screening. And for the elderly, if you have your grandmothers, grandfathers at home with poor vision, poor hearing, then they should be getting their eye screening done, their hearing screening done. Patients with, your family members, if they have diabetes, they should be getting their annual eye screening done. Make sure their eye is not affected by diabetes. Some of your parents may be on certain medications that require them to get their annual eye screening done. So don't forget these important things, that eye screening and also hearing screening, because in the elderly, loss of vision, loss of hearing results in a lot of impairment in them. It leads to depression, leads to frequent falls in the elderly. And what happens when you get frequent falls? Then their mortality rate increases. Yeah? Once they have one fall, their mortality rate in a year increases by 25%. So we don't want that. We want our elderly to be safe at home with us. So these things are important. Get them, take them to your nearest ophthalmologist, get their eye screened, take them to the audiologist, get their hearing screening done, get them hearing aid. So these are some of the health screening tools that are available out there. Yeah. And that people should consider.
Okay, that's actually very beneficial, doctor. And you have, in fact, talked for all the group category of people from the youngsters to the old age. Now, how regularly or how, like for instance, if I were to go and check now, I'm perfectly healthy. and I go into the conclusion once again, okay, I'm healthy, I'm not going to go and check again, so how would you advise those, like, if you are already, that your body is healthy, how regularly we need to check? We
I
need
would
to,
say annually. Get, if
and
you're not seeing your doctor once every year, then I think then we are missing out on a lot of things. Like we probably miss out on some things we can pick up. So try and meet your doctor annually. If we're healthy, it's great. You haven't had to see them, because there are things that you would want to get as well, like vaccinations. You would want to get your yearly influenza vaccination, right? So this is a chance to meet them, get your health checkup done as well. And earlier, I think one population that I didn't cover was children. And children in vaccinations. So we have to make sure they are up to date with their vaccinations. And vaccinations are a great way that encounter when you have vaccination to follow up on your health as well. So you can sort of just combine them all together. And then you can meet your doctor, get your vaccination, do your health check, and then boom, you're done for the year, and then you can be happy. And it will give you, it's not just getting that clearance, oh, I am healthy, I'm fine, I'm going to continue what I'm doing. It's more about, like I said, maintaining that healthy lifestyle, right? So meeting your doctor will give you the opportunity to kind of do that check. Okay, am I doing the right thing? Am I doing the right thing with my diet? Okay, are there any new things I can learn? Can a doctor tell you about some of the new technologies or some of the new studies that have come forth? So it's also part of learning, for us, with our, and just getting comfortable with our skin and our health. And if we are not meeting our doctors, then we're not going to do that, because I feel that we are just going to take our health for granted. So I think meeting them will be, even if you're healthy, it will be a two-way learning process, and it's going to keep you engaged and motivated.
thank you,
Mm.
doctor. That's actually a great advice for you, like me too, and to many out there who is listening to our talk right now.
Yeah.
And you previously, just a while ago, you did also mention about smoking. A patient, for instance, he particularly need to stop smoking and then go for health checkup. So that is actually something related about health empowerment itself. And I do realize that you do talk about it on your page as well, and fitness and so forth. Now,
Correct.
in your definition, what do you think is patient or health empowerment?
Okay, I'm very passionate about this. I want all my patients to become empowered.
Mhm.
Okay, and what does it mean to be an empowered patient? Okay, so patient empowerment, the textbook definition of it is when a person, that means a patient, can make health choices, and they are given the skills and knowledge by their doctor. That means the doctor shares with them the particular knowledge, the particular skill, and the patient has that positive attitude to make those positive changes in their health. So that is patient empowerment. But simply put, it is about taking charge of your health. Okay, so why do you need to become an empowered patient? Is that once you take charge of your health and you start making that positive health changes, then you are likely to improve your quality of life and have a better health overall. And comes back to the whole passive and active thing we spoke about in the beginning.
Yes.
Yeah. So the difference, okay, this is the difference between, I'll just give an example of an empowered patient and non-empowered patient. We come back to diabetes. All right, so let's say now I have been diagnosed with diabetes. Okay, what do you think a patient who is not empowered, how do you think a patient who's not empowered is going to think versus a patient who's empowered? Just
Just
from the little brief talk I've given.
from a general, I mean, as a
Yeah.
person myself,
Yeah.
I think a diabetic patient who's not empowered will find everything negative, will find impossibilities in everything, and she's unable to cure, and that would self would absorb her energy and would not motivate her to go further. And likewise, from what you have mentioned earlier, looking at the two-way communication with doctor, there's somebody to always monitor, motivate you, and to let you know that you're doing okay and you're doing better. That would keep someone keep going. Yeah.
Yeah, so spot on. So if you do not take charge of your health, firstly, you're likely to be like, oh, why is this happening to me? Secondly, you're likely to be in the denial phase for a longer time. You're not likely to be actively participating in your care,
Yes.
and you're going to be less motivated. So what an empowered patient would do is, okay, firstly, they will try and get knowledge around the condition. They will say, okay, what is diabetes? If you don't know, ask your doctor. Your doctor can easily explain to you, what is diabetes? Okay, I have diabetes. What's next? Has it affected any other organs? Okay, so that's the next question. Then after that, so what do we do next? Let's say your doctor is starting you on any medication. Ask them questions. Ask them, what is this medication? So I always say, ask the big W's. What is it? Why is it needed? When do I need it, or when do I need to take it? And how do I take it? Okay, and how much of it do I need? Yeah, so these are the questions you need to know. Even if you're taking a simple cold medication, let's say you're going to see your doctor about a flu or a cold, ask them why you need medication. Don't just take those 10 bags and come home and be like, okay, what did the doctor give you? Oh, did you give me all these 10 pills? I'm just going to chuck it. No, that's not how you should work. I want you to become an empowered patient. So when you get that medications over the dispensing counter, ask them, what is this for? Okay, this is cold. How does it work? Get them to explain it. Oh, it's an antihistamine. Okay, antihistamine. When should I take it? You should take it at night. Is it going to make me drowsy? Because if you're going to be driving a bus and you're taking a drowsy antihistamine, then that's tough luck,
Causing
right?
an accident.
So
Yeah.
ask your doctor question. Okay, then, oh, but why have you given me 3 different antihistamines? Do I need all these 3? Okay, so what do I do with this now? Paracetamol. Okay, I can take paracetamol. Let's say they've given you an anti-inflammatory. Ask them, what are the side effects of these medications, anti-inflammatory? So ask questions, actively participate. If you do get diagnosed, don't just take the diagnosis and come back home. Ask them, oh, what does the diagnosis mean? The other dangerous thing that people do is they go and Google, and then they freak them out when they Google, because
Yeah.
Google tells you the worst case scenario sometimes, or there's a lot of chances for misinformation. So don't fall into that trap. They say, oh, Dr. Vani told me to research, so I'm going to go on Google and start and freak myself out. No,
Yeah.
ask your trusted, because your doctors have know where to look for the right sources, or know which study to look at. Yeah, they've been trained to do that. So speak to them, ask them questions, and actively participate, engage, be present. If you're given an appointment, be present at the appointment. Don't send your father or mother to sit at the appointment. Okay, it defeats the purpose. All right, I get a lot of patients coming, oh, my son is not well, but I'm coming for the appointment. I'm like, okay, how can I help you? So actively participate. Of course, if there are certain physical limitations, they really can't make it due to some reasons. There are some patients who are bed bound and they can't make. That's a different story. Okay, over here we're talking about general healthy people. So
Yeah.
actively participate, actively engage, ask questions, know your condition, know what you're taking. I have patients who've lived with certain chronic conditions for years, and they are on, let's say, 6 different medications, but they would not know what the names of the medications are. And that is very, very sad, because I want them to know what they are on, because when they turn up to the hospital, they won't even know how to explain. There are patients who tell me, I've met patients in ED, it's like, do you have any medical problems? No, I do not have medical problems, doctor. But then they'll have all the textbook medical problems. It's not because they're just not aware, and they're not taking charge of their health, and they're playing the passive role. So actively take charge. It's your health. Because if you don't take charge of your health, no one is going to. And if you don't care about your health, no one else is going to care about it. I could be sitting here harping for the next 1 hour about this, but if you don't actively engage, then it's not going to make a difference, right? So, and the other thing I tell people, we spend money on so much of things these days. We have our online shopping, we have all sorts of things, food. We're spending stuff on so many things. Spend that small amount of money on your health. Get yourself checked, know what's important for you, know your health, get to know yourself. It's gonna take you a long way. So that's my kind of a big spill on patient empowerment. So people need to actively take charge of their health.
So actively take in charge and communicate a lot with their doctors
Yes.
to know better
Communicate,
on their
talk.
condition.
That's right. Ask questions. In fact, I think doctors to some extent appreciate it when you ask questions, and they'll be happy to explain. And if they do not have the answers, I'm sure they'll be able to look it up and also explain. So especially if they're practicing evidence-based medicine. Mm.
That should be very helpful because as a normal person myself, sometimes when we go and seek the doctor's treatment, we may not have the doubt or the questions to actually ask the doctor.
Right.
And sometimes we might be afraid if we ask too much, would he be answering? Would he or she be answering to us?
Yeah.
So that now will break with the thought, the perspective of a regular patient. And
Yeah.
now looking at we have a question
Hmm.
from one of our viewers. Hi, doctor. Many youngsters may not have enough of budget when it comes to doing health screening. Uh, I think this particular person is trying to ask about the budgeting on health screening.
Um,
Maybe you can stress on that, doctor.
So
The
that's
question
where I
is
come
very
back to prioritizing our finances, right? Many, this is when you have to look at your finances overall, and see where you can save money, where you can try and put it. Because the way I look at regular health checkup, your money is not going to waste. It's actually an investment you are doing on yourself in the long run. It's like, when you pay for your education, it's an investment because you are going to be getting that back in the future. You're going to be working, you're going to be improving yourself. And same goes to health. The more healthy you are more likely to be more productive, and you're more likely to lead a more happy, fulfilling, and a better quality of life, right? So try and see if there are ways. If your parents are able to help you, then that's great. Your parents can help you financially. If you are an independent person, see whether you can reduce some of your unnecessary cost, or perhaps, let's say, those 20 ringgit a week that you spend on fast food a week, perhaps that budget could, a five, or let's say if you were to do a health checkup with me, if it's 20 ringgit, then perhaps a 2 months budget cut on the fast food would help you do a yearly health checkup. But I know it sounds like, when people look at it, because they don't look at it as an investment or a positive outcome, so that's when it looks like an expenditure or a burden. But it's about changing your mindset into what is a good spending and what is bad spending. So I feel it's an investment. Mm. I hope that was helpful.
It now actually gives me a picture rather
The
than
other thing that I want to talk about, so if you
yeah,
can afford it, get yourself health insurance early. Okay,
yeah,
so that's the other thing. I think people take this whole health insurance thing for granted as well. You don't need five different types of health insurance. Go and do your research and find one good comprehensive health insurance. Don't ask me which brand now. I'm not here to
yeah,
suggest which health insurance is good. You can do that research yourself.
yeah.
But get yourself a health insurance. So for rainy days, you are covered. Mm.
Mhm, mhm. So a good health insurance and
Yes,
a good
definitely.
health screening,
Mm.
that would be a great investment to a
Absolutely.
better health in the future. Okay, and there's another question. What is the best place for health screening tests would you advise on? Which I think you have stressed earlier, but maybe you can rephrase it.
Again, most simple health screening and regular checkups can be done at your nearest general practice. So again, go and have a look around, see who you're comfortable with, see what they're offering, or there are hospitals offering screening packages as well. You can, these days you can just Google screening packages and then they come up. Like for instance, I was looking up a cardiac screening package for my dad just yesterday. And then all I had to do was just put in cardiac screening packages, and then I have the list, because most hospitals have websites now.
Yeah.
So you can kind of look through what they're offering. If you are concerned, you're not sure what exactly, if it feels like it's gibberish to you, then speak to someone who you can trust, or they know what they're talking about. Ask them, hey, which package should I go with? If they're a trained medical doctor, that's better. And or if it's someone with some good health awareness, health literacy, that's great. Or if you just drop me a DM also, if you just ask me, hey, this is fine and all, I'll be happy to answer, as long as it's not like a personal health related question that I can't answer over DM. Mm.
And I think our throughout our entire discussion today have been very insightful, and it would definitely help many. And everybody will be ringing their family doctor right now for after long of not communicating with them.
Yeah.
Um, as for me too, I don't see any more questions, and I think you have given us a great explanation on the importance of health empowerment and health screening. But there's just one more question that came into my mind. Just one last question, doctor.
Sure.
Um, Now I have a doubt on, for instance, like blood tests. Yeah, blood test and how I believe it falls in the category of health screening as well, right? So, what are the expected like for example, if you're healthy but you want to do blood tests, would you advise on that?
So that is very individual. So that
Mm.
again, that's where the whole history and examination part comes in. So if I were to consult you, I'll be taking your health history, your personal health history, your family health history. I'll be taking your age into account, your current health into account, examining you. Then I'll be advising what are the relevant blood tests you need. At the moment, all there are laboratories which are offering packages just because
Yeah.
it's just cheaper to get it done that way. These packages come with the whole, it depends on the amount you're paying. It comes with the whole shebang, got your full blood count, your renal function, that means your kidney
Yeah.
function, your liver function. And most doctors would recommend the panel just because they come as a package. It's easy to do and you have all the results. But sometimes certain things, if you over screen, then it's a bad idea also. So
Yeah.
what tests you get, what blood tests your doctor recommends will be based on your health risk profile. So it's very hard to give a general, these are the blood tests you should be asking your doctors. Mm,
Okay, okay.
yeah,
So it's best to get a consultation first and then only the
correct.
blood test.
That's
All
right.
right, okay. And Vin sent a comment. Good one. Good one, guys. Thank you.
Okay. Thanks,
Um,
Eunice.
I think as of now, no more. As for me too, I have no questions because you have actually educated me, and I hope it's the same for many others today. And
Yeah.
I don't
Thank
see
you
any
for
more.
this opportunity, and thank you for giving me this platform to be able to share this. I feel what is a very important thing, what I'm really passionate about. And people can always look at my page as well if they want further information. Feel free to message or comment if there are certain topics that you would want me to discuss. And Yamaya, you're free to call me back as well if you want any other topics,
Sure, sure.
because I am all about sharing. So
That's great, doctor. Because hello. Yeah.
yeah,
Okay. I lost connection just shortly. I think I feel like there are many actually have to hear the medical speech coming from the right person because we have too much of people busting all out in the social
yeah,
media, especially when I see these diet drinks pills
yeah,
that are being sold off, and I
yeah,
think people really have to differentiate why is it important for you to be an empowered patient, for you to get a consultation from a doctor and then only purchase a consumable pill that is good and verified.
yeah.
With that, I think, Doctor, we are truly happy to have you on our platform today. I think today was a very insightful discussion. It would be very beneficial to many. So,
Thank,
with that, thank you so much, Dr. Vani, and
thanks.
yeah, and thank you so much to all our viewers. Do share this video around, and if you wish to get consultation from Dr. Vani itself, do hit her up on the DM at Dr. Vani Chandran on Instagram.
Mm.
Yes. Okay. Thank you. Thank you so much.
Okay, bye everyone. Have a good evening.
Bye.